Hello, cruel world. What is Munchausen syndrome and what is Munchausen's by proxy? What are the typical features? What are the psychological and cognitive processes behind it? Have I ever seen a case of these disorders? Are there any high-profile true crime cases that are connected with this diagnosis? Are there any celebrities who got experience of these diagnoses? I'm going to answer all of those questions and more within this 3-part series. And in the third part, I'm going to give you my opinions on the film Run, which is on Netflix right now, which is a psychological thriller, and I'm going to explore the dynamics of Munchausen's by proxy in that film. So, welcome to A Psych for Sore Minds. I'm Dr. Sohom Das. I assess mentally disordered offenders for a living so that you don't have to. So I have to say that Munchausen's by proxy fascinates people. It's something that as a psychiatrist I get asked about quite a lot, although it is actually extremely rare. In fact, I've only ever seen one case of it, which I will come to later on in this video. First of all, I'm going to describe what Munchausen syndrome is, and then we'll go on to by proxy. So in psychiatric terminology, it's known as factitious disorder, and it's a rare type of mental disorder where a person fakes illness. So the person might lie about symptoms, they might make themselves appear sick, they might actually even make themselves literally unwell on purpose. And it can be very convincing, and it can result in doctors providing unnecessary treatment such as medications, or in extreme cases, people even undergo unnecessary surgery. Now, the important bit to remember is that Munchausen syndrome, the people, they don't pretend to be ill for personal gain. That is called malingering. So for example, as a consultant forensic psychiatrist, I see defendants who fake mental illnesses during their trial because they want leniency in the court case, or they hope that they will be acquitted. And I also see prisoners who fake mental illness, and that's often in the context of trying to get their hands on prescribed medication. For example, diazepam, otherwise known as Valium, is a medication for anxiety and it can give you a buzz. So some prisoners fake this to try and get their hands on diazepam. Also, in a female prison that I've worked in a while ago, quetiapine was all the buzz. So it is a weak antipsychotic and it gives you a little bit of a high. And I saw a woman coming in and she was faking psychotic symptoms. She was telling me that she heard voices coming from the toilet bowl. I kind of gave her the benefit of the doubt, prescribed her a low dose of quetiapine, and then the next woman had exactly the same story, and the next and the next. So obviously my suspicions were raised. If you're interested, I've done a 3-part series on faking mental illness, which can be found on my channel, including talking about real life cases that I've seen. So what is the psychology behind Munchausen's? What's the drive for the person to behave the way that they do? Well, there's lots of complicated psychological reasons, and one of it is a strong sense of desire for attention and sympathy. And often the perpetrators have a traumatic childhood themselves, and they've been through a lot of really harsh experiences, so they need and they crave that comfort coming from other people, which wasn't provided by their parents in childhood. The difference between Munchausen's, which I've just been talking about, and Munchausen's by proxy is that in the latter, people lie about their child's symptoms and they change test results and they make the child appear physically unwell. Sometimes they even harm the child to do so. So I'm saying child because that's what happens in the vast majority of the cases. It's usually from mother to small child, but technically it could happen in a different kind of relationship, say a vulnerable parent. Fathers or male caregivers only occur in 7% of cases, so overwhelmingly the perpetrators are women. And also the victims are usually very young, so 75% of cases involves 6-year-old kids or under. And there isn't really a single cause as such, and we don't know much about the etiology. So etiology is like posh psych speak for attributions of a disorder. We don't know a lot about it simply because it's so rare that you don't have a big enough sample size to make any strong conclusions. But we do know that the perpetrators usually have poor self-esteem, they usually struggle with anxiety, and the care that they need gets them attention. So it gets them attention from doctors, from nurses. It also gives them a kind of status. So previously they may have struggled to achieve any kind of notoriety or status or recognition in the community, but now they get this through the care. So people show them kindness. Sometimes people give them money or look after them, show them affection, sometimes cook them meals. So later on in this episode, I'm going to tell you about the case of Dee Dee and her daughter Gypsy Rose, but just going to briefly say that they accepted benefits from charities including Make-A-Wish Foundation, Ronald McDonald house. So that's very much in the picture of how Munchausen's by proxy works. And this behavior reward cycle kind of perpetuates. So if the mother acts in a certain way, gets a reward, which in this case is care and attention, then it continues the drive for the behavior. So firstly, I'm going to tell you that Munchausen's syndrome by proxy was coined, the phrase was coined by a pediatrician, a famous pediatrician called Professor Roy Meadow. Just to go on a quick tangent, I know a lot about this guy because in the medico-legal world, there was a case which was a big deal, which involved him separate to Munchausen's. So in 1999, a solicitor named Sally Clark was tried for allegedly murdering her 2 babies who died at 8 weeks and 11 weeks old. And several leading pediatricians testified that the deaths were probably natural causes. But this guy, Professor Meadow, was a renowned and highly respected pediatrician, and he claimed that it was murder. And he testified in court that the odds against 2 deaths occurring in the same family was 1 in 73 million. And his evidence was a strong reason why Sally Clark was sent to prison. But it turned out later that he'd given incorrect expertise because he wasn't an expert in statistics, but he was in pediatrics. And after 2 appeals, Sally Clark was eventually vindicated, but tragically she died unintentionally in March 2007 from an acute alcohol intoxication. Apparently the theory is that she reportedly never recovered from the psychological trauma that she went through, that is 2 babies' deaths and then being unjustly imprisoned and then being separated from her 3rd baby because of that imprisonment. So that is a bit of a tangent, and I'll definitely do a separate video one day about this case. With Munchausen's by proxy, breathing problems and feeding problems are the most common presentation. So each one of those represents a quarter of all presentations. And then the next common one is diarrhea. So I have a question for you, dear viewers, which I will answer later on in this episode, which is this. Can you guess which celebrity claimed that their mother had Munchausen's and put them through all this fake illness, presentations and behaviour? As I said, answers later. Next question is, what are the consequences of Munchausen's for the kid? Well, they can end up getting painful medical tests and procedures or treatments that they don't need. And sometimes with the mother's behaviour, they can become seriously ill or injured. And sometimes they can even die. So that has happened. In the case that I'm going to tell you about in the next episode of D.G. Blanchard, she ended up being killed by her own daughter, Gypsy Rose, because of the trauma she put her through due to Munchausen's. So what are the characteristics of the perpetrator? They tend to have medical skills, like they've worked as a doctor or a nurse. They seem devoted to their child, at least superficially, so they don't come across as somebody who would abuse or be aggressive towards their child. They look for sympathy and attention, and they need to feel powerful and they need to be in control. And importantly, they don't see their behaviour as harmful. So what are the suspicious indicators of Munchausen's? If you were a detective and you were investigating this, what would make you think, hang on, something's not right here? Well, if the child has repeated or unusual illnesses that are not medically explained, so if they have a bunch of symptoms that doesn't really fit into a recognised diagnosis. So I'm going to give you an example here, which are dermatomes. This is something that I vaguely remember from my days at medical school hundreds of years ago. So dermatomes are like patches of skin that are directly connected to individual spinal nerves. So they're very specific. So if somebody has, either child or adult, has like pain or numbness or tingling that doesn't match those exact patches, if they go across dermatomes or if they're just in one random area that we know that nerves don't specifically run to, then we're suspicious that there's not a physical cause for it. Often in psychiatry, separate from Munchausen's, it can be somatoform disorders. So somatoform disorders is where you get, because of psychological distress, you get physical symptoms. I remember many years ago, I assessed a woman who apparently turned blind in one eye after she lost her husband in a car crash. And she was thoroughly investigated and there was no physical reason for her to be blind. She had CT scans, etc. So just to be clear, I'm not saying that this patient was lying or that any patients are lying. I'm sure the symptoms feel really real to that person. I'm just saying that there's no physical organic cause. It's because of psychological stress. So I'm just mentioning this because those are the kind of clues that you get that illnesses do not quite fit in with expected patterns. Anyway, so in terms of other features, the child doesn't get better even with the appropriate treatments, and the symptoms often only occur when the caregiver's been around. So the caregiver's done something to the child and that's why the child appeared ill, and then they've moved on and then the child appears better. Usually the perpetrator is the only adult involved in the care, because if you think about it, if they weren't, they would have to fool like a fully grown other adult as well. And they often seek medical treatment by repeatedly changing their doctors, and this is often how they're caught, because they do what we call doctor shopping. They don't get the answer they want, so they go on and move on to another doctor. And also, normal test results don't reassure the caregiver that things are okay. Finally, there might be other children in the family who have unexplained illnesses. So the next question is, can you cure Munchausen's? The short answer is no, you can't cure it, but you can treat it through therapy, although often the perpetrator has to go through the criminal justice route, including potentially prison. But it kind of depends on whether you've crossed the threshold of actually deceiving people and actually hurting a child. So if you've got a mild case of Munchausen's, perhaps at the beginning of the disorder, where the perpetrator was caught exaggerating, but let's say not fabricating physical illness to their child, and they haven't yet caused the child harm, then the best treatment would be to help the perpetrator gain insight into their actions. So you give them kind of therapy, you force them to weigh up the harm to the child versus the benefits of the attention. Often the perpetrators deny they've got a problem because they have no insight, so that makes it even harder. There is no medication that reverses the thought process of Munchausen's. However, the psychiatrist can treat other mental health problems such as anxiety. Obviously, the child and the adult have to be monitored in the long term very, very carefully in case their behaviour escalates. You might need to get social services involved. So before I tell you about the only one time in my career that I've seen Munchausen's by proxy, I thought I would quickly introduce you to this channel. You are watching A Psych for Sore Minds. My name's Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders in prisons and in courts and in secure psychiatric units. I also give evidence as an expert witness during criminal trials. I do a whole range of videos on this channel, some to do with high profile crime cases. Sometimes I interview ex-patients or people who've got experience of mental health issues. Sometimes I talk about individual diagnoses. What I'm trying to say is there's something for everybody on this channel. I have to admit, Munchausen's by proxy is not a diagnosis I'm particularly familiar with. If you look at my other videos, I often talk about individual cases of diagnoses. I do that in detail. This one, I can only tell you the basics because it was a long time ago. I was a very junior psychiatrist. It was back in 2003. I was working for a liaison psychiatry team in a hospital in Edinburgh. And this woman came in and she was mainly dealt with by the senior consultant because it was such a rare and difficult case. But I did accompany my consultant to assess her. And basically, she come in with her kid and she claimed that her child had a diagnosis of multiple sclerosis and had the symptoms. And the hospital did a quick background check and it appeared that they'd already done a number of tests, including a biopsy at different hospitals. But the mother didn't state this to any of the doctors when they talked to her about it, which is an unusual thing not to mention. Then they did more background checks and it turned out that she had been doctor shopping, so she went around all these different places trying to get the answers that she wanted. Then she was referred to our psychiatry team, then we assessed her, and I have to say that from what I remember, she appeared very plausible. So she kept saying, I don't know what you're talking about, the records must be wrong, this is the first time I've ever seen a doctor. And on the surface she seemed very believable, and I did it went through my mind that we were kind of harassing this poor woman for no reason. But the police were called and the social services were called. I'm afraid I don't really know any more details because such a long time ago I didn't know I'd be making a YouTube channel back then, so apologies. I'm not sure what happened in her medical legal case. What I can say is, as an expert witness, I've done well over 500 criminal court case assessments, and not one single one of them has been Munchausen's by proxy. I've literally assessed more murderers, never Munchausen's by proxy. In the next episode, I will talk about the psychiatric defense and whether in theory it can work for Munchausen. So specifically, not guilty by reason of insanity. Okay, dear viewers. Now, I asked you before if you could guess which celebrity claimed that their mother had Munchausen's by proxy and put them through false illnesses. It was, of course, Eminem in his song Cleaning Out My Closet. Witnessing your mama popping prescription pills in the kitchen, bitching that someone's always going through her purse and shit's missing, going through public house system, victim of Munchausen syndrome. My whole life I was made to believe I was sick when I wasn't. And aside from that song, Eminem has said in several interviews that he was a victim of Munchausen's, that his mother tried to convince him and other people that he was ill. And in fact, that's the reason that his younger brother Nate was placed in foster care at the age of 9. If you know anything about Eminem, you will know that him and his mother Debbie's relationship has always been a bit dysfunctional, turbulent. In fact, in 2001, Debbie tried to sue him for $11 million. To conclude, hopefully this video has given you an overview of Munchausen's and Munchausen's by proxy, the psychological processes, the difference, which should set you up nicely for my next video. So in my next video, I'm going to tell you more about a case which I briefly mentioned, which is the case of Dee Blanchard. So she was killed by her own daughter, or I should say her killing was set up by her own daughter, although it was her daughter's boyfriend that carried it out in June 2015 in Missouri. And it later turned out that Dee Blanchard had subjected her daughter Gypsy Rose to Munchausen's by proxy. So go check out that video when it's out. As well as telling you the background of the case, I'm going to use my USP, the thing you cannot get from other YouTube channels, which is I'm going to highlight the expected psychiatric features of Munchausen's and see how closely this case connects to it. And then I'm going to talk about psychiatric defenses. So as I mentioned before, I'm going to say specifically whether a mother can get a defense of not guilty by reason of insanity. Okay, I'm about to tell you about more about my channel, but first, I'm excited to share some news with you guys, which is that I'm going to be a speaker on CrimeCon UK in September in London. It is a huge convention in the States and it's coming over to the UK for the first time ever. It's a convention that will tell you about serial killers and unsolved crimes. You will hear from criminologists, from law enforcement agents, and from your favourite podcasters. I'll be doing a talk where I'll talk about 2 real-life cases of people that I've assessed who've killed their own family members. One was mentally ill and one wasn't. If you really are a true crime enthusiast, you cannot miss out on CrimeCon UK. Use the link in the description below to get the tickets, and because I've got you, you can use the code PSYCH at checkout for 10% off. Please subscribe to our YouTube channel because not only does it help me out immeasurably, but it guarantees that you'll never lose your house keys ever again. I promise. Tell your favourite people about Psych for Sore Minds. They deserve it. Spread the love. Hit us up on social media, Facebook, Instagram, etc. Until next time, stay euthymic and remember, I love you.